This is an ABC News special report.
And hello, everyone. I'm Kira Phillips. We are coming on the air with breaking news as we have just learned that the President of the United States, Joe Biden, has tested positive for COVID. He is vaccinated. He has had 2 boosters, but as we've been talking about for a couple weeks now, the spread of COVID taking off across the country, numerous states reporting a rise in COVID cases. And now we are learning the President of the United States has tested positive for COVID-19. We just received this statement from the White House, and this is what I can tell you so far, that he is experiencing very mild symptoms, according to the White House. He has been isolated. He does plan to continue to carry out all his duties fully at this time. He has been in contact with members of the White House staff by phone this morning. He has been making calls to those that he traveled with this week, specifically when he gave his speech on climate change. He had various aides with him. His press secretary, Karine Jean-Pierre, of course, was with him. In addition to his deputy chief of staff, Bruce Reed, also Gina McCarthy, National Climate Advisor. They have been notified that he has tested positive. Do not have word yet on the First Lady and where that stands, but we can tell you he is also taking the antiviral Paxlovid. This has proven to be very effective when you have taken this antiviral, when you find out that you have tested positive. So he is taking that. We are told that he does plan to participate in all planned meetings and work in isolation there at the White House. Dr. Jen Ashton joining me now as we receive this news that the President of the United States has tested positive for COVID-19. So, Jen, really no surprise. I mean, we have been talking now for a couple weeks on how COVID has been spreading. And for a number of years, a number of us have been lucky that we haven't tested positive, but now have. And now the President testing positive for COVID.
Right, Kara. And to be honest, so many people, just when you talk about President Biden, are surprised that he's been able to avoid this for so long. But we have to look at his medical condition and who he is, and then what we know about this virus and how COVID behaves. As we know, he is 79 years old. His last presidential physical evaluation was done in November of 2021. He got very high marks from his personal physician, but we do know that he has some basic medical conditions, atrial fibrillation, some high cholesterol, some gastrointestinal reflux. None of those really put someone at particularly high risk, but his highest risk factor, Kira, is his age. And so that is why, as you mentioned, no surprise that he's being treated with the antiviral pill Paxlovid. It's been shown in clinical trials to be 89% effective in reducing the risk of severe COVID-19 illness, meaning hospitalization or death. But I want to be crystal clear, he is going to be closely monitored at the White House by the personal physician of the president. And if anything looks like it is going in the wrong direction, I absolutely expect that he would be hospitalized. If nothing else, then for more close observation. But remember, the White House is not like your home or my home. They can do a lot of medical monitoring and observation and testing right there at the White House.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.